Hello, everyone. My name is Ryan Eborn, and I am here today on behalf of the marketing team with School Health. I wanted to start off by thanking you for joining us today and participating in our webinar with Christine Drucker, who is a strategic account executive with PSNI, that's Professional Software for Nurses. And Christine has many years of working with electronic health records in the K-12 environment. Her experience has allowed her to gain a unique insight into the role and responsibilities of school nurses and others within a school system who are using electronic health records, and to gain insight into how electronic health records can support decision-making within the educational system, especially when it comes to dealing with the COVID-19 crisis as it unfolds. Before I turn the time over to Christine, I would like to review a few quick things about today's webinar. First, we will not be taking audio questions, but you can submit your questions through the questions interface in GoToWebinar. You can submit your questions anytime during the presentation. Christine is planning to take around 45 minutes for her presentation, after which we will begin to take the questions in the order in which they were received. This webinar is being recorded, and a link to the webinar will be posted on our schoolhealth.com site as well as on our YouTube channel. We will also email everyone who has registered for the webinar a link for future playback. So if you'd like to take a look at this presentation again or share it with a colleague, just keep an eye on your email, and we'll be sending the recorded link out to you this afternoon. As we mentioned in our emails leading up to the webinar, we are not doing certificates for this presentation, but like I say, we will be sending out a copy of the link for the recording for later viewing. And lastly, if you are having technical difficulties with the audio or visual portion of today's webinar, please contact GoToWebinar directly at 855-352-9003. And again, that number for GoToWebinar is 855-352-9003. And now I will turn the time over to Christine.
Thank you for the introduction, Ryan, and good afternoon, everyone. Thank you for taking the time to join this webinar. Before we begin, I just want to take a moment to thank all of you joining today. Thank you for all that you do each and every day to protect the health and well-being of the students in your care. We can only predict what life will look like when schools reopen. We do know it will be different with new and evolving challenges. We do know that the role of health services will be more vital than ever before. And we also know that you'll need every resource available to help you face these new challenges. Throughout this webinar, you will identify how the functionality of Snap Health Center software supports schools under the new norm. We will explore ways to protect the well-being of students and staff through electronic health surveillance. You will also recognize how powerful reporting and data analytics combined with real-time communication can help detect an outbreak before it occurs, while providing data to administrators so they can make educated decisions. During this webinar, I will share how Snap's functionality currently supports meeting several of the guidelines provided by the CDC for reopening schools. And as COVID-19 evolves and recommendations change, Snap can be easily modified to meet fluctuating guidelines set forth by the CDC or the requirements of your state, county, or district. Before we dive into the scenario-based demonstration of using Snap Health Center to manage the COVID crisis, I will give a quick overview of how school nurses and administrators have been using our EHR for more than 2 decades. As a nurse-directed corporation, PSNI has a unique understanding of the needs of the school nurse. Nurses can serve over 60 students per day, many with severe and complex medical conditions. Beyond sick visits, nurses are responsible for individualized healthcare plans, emergency action plans. They provide various screenings and referral, administer daily medications and treatments, and track immunization compliancy. What's more, No other health professional care for so many under one roof by themselves. What's even more challenging is all of the activity needs to be documented. Unlike the health module in a student information system, or SIS, designed by engineers, SNAP was designed by nurses, making it very user-friendly so that nurses can document and track all of the activity that takes place during a typical day. Different from a student information system, or SIS, used for grading teachers and principals, SNAP is focused on health documentation. For those of you joining today that are not nurses, SNAP supports you too, because it's a full EHR. Some of the challenges schools are faced with cannot be adequately handled with a SIS. These include state requirements for health services reports, which can be linked to funding. The free care policy that is opening up states to allow billing on Medicaid eligible students. Districts are always looking to identify at-risk students and improve absenteeism. Schools are vulnerable to liabilities, whether it's an injury or health-related emergency. Administration of controlled substances and expensive medications also poses additional accountability. And cybersecurity and privacy issues are always at the forefront with online applications. SNAP provides a solution with over 200 common reports that can be easily run on demand. Billable time for Medicaid can be efficiently captured at time of service. Students at risk can be identified with health trends. The risk management feature in health surveillance monitoring protects the district from liabilities. Medication inventories and audit trails provide safeguards, and SNAP is FERPA and HIPAA compliant. Your data is secure and protected. There's so much an electronic health record can do to support school nurses while reducing district liability and giving administrators valuable and meaningful data they need to make decisions. Now I'll be focusing on 7 scenarios you'll experience in real time that demonstrate how SNAP Health Center will support reopening schools and how you can continue to manage monitoring the overall health of the population within each school and across the entire district. Please keep in mind, with the limited amount of time we have today, I cannot cover all scenarios. CDC recommendations include monitoring of the health of the district population. SNAP's design incorporates functionality to assist schools in preventing or slowing down an outbreak before it occurs. The health surveillance feature was originally developed in 2009 to support school nurses during the H1N1 or swine flu pandemic. This isn't the first time we've seen a pandemic, and we're not trying to rush out some helpful functionality like so many other systems are. Because our founder was a school nurse, we saw this need more than 10 years ago, and our customers have been depending on it ever since. In this scenario, I'll be demonstrating how SNAP monitors health trends associated with COVID-19. As the school nurse, I need to document and track all COVID-related encounters, including reported conditions and illnesses, absences, and visits. So in this scenario, I'm the middle school nurse, and I just received a call from Kyle Williams' mom, who states that her child has tested positive for COVID-19. So I can document this as a condition. Then, during a re-entry screening, Catherine had a high temp and a cough and was sent home. I can document this as an absence. So I just want to point out while I'm here that if you're not required to document absences, SNAP can import from any SIS. So you can have absences brought into SNAP, or you can have them exported. So that way, if you need to track those data points, you have that ability to, whether you put them in yourself or bring them over from the SIS. Now it's the middle of the day, and I have a student walk in. It's Alyssa Diaz, and she says she doesn't feel well. And I see that she's coughing. So I'm going to use one of the templates that are included with my program. So this template was designed by the nurses on staff here at PSNI, but they can be customized. This one's been customized with my district-specific protocols. So I take Alyssa's temp, and it's 102. I applied a mask, isolated her from well children, called mom, and told her that Alyssa has a fever and cough and pick up as soon as possible. I notify the principal. I have Alyssa immediately wash her hands. And then before I dismiss Alyssa to home, I have a discussion with mom about hand hygiene, our district policy, 14 days quarantine, and recommended that she contact the primary care provider. So this template, it saves me a huge amount of time as a nurse. And again, it provides district-wide protocols. Open that up. So in that scenario, I just added a COVID-related condition, absence, and visit. Each time I entered a data point, it's being monitored in the background. SNAP looks at the threshold and notifies my principal, superintendent, and health department, basically anyone in my district that my district has decided to notify. As a nurse, SNAP enables me to continue triaging, multitasking. I don't have to worry that a health trend might be overlooked. My administrators also feel confident knowing they will be alerted to any health risks. I've just shown you a few ways that SNAP collects data, which again is now being analyzed in the background. Now to the most important piece, sharing the data with those who need it when they need it. A major part of monitoring the health of the district population is consistent communication with administrators so that they can make data-driven, educated decisions. In the previous scenario, I entered a COVID-related condition, absence, and visit. So now I will be demonstrating how SNAP communicates health trends alerts with pop-up message and automatic email. This pop-up appeared in my school, so I'm the middle school, the nurse at the middle school. That visit I just documented with Alyssa is right here. So SNAP saw that it was a COVID-related condition or health trend, and it applied a pop-up. Same with the condition and absence that I added. So as the nurse, I can see the activity or health trends that are going on within my school. As the nurse leader, I can see all the schools throughout the district. As the principal, I will be communicated through an email. So I'm busy with meetings. I don't have time to be consistently reaching out, and the nurse is not having to call me. Same thing with the superintendent. I received this as a superintendent. Again, I'm very busy, but I'm always kept aware of what's going on with the health within the entire population within my district. The same email can also be sent to the health department. So communicating information in real time is very simple. So in that scenario, I just shared how SNAP communicates health trend alerts in real time via pop-up messages and email. And as a nurse, I'm always aware of alerts in my school. As a nurse leader, I have a district-wide view of health alerts. As an administrator, I receive relevant information and can use this data to support decision-making. To be proactive, you do have the ability to identify other potential health trends or risks by running reports in SNAP. For example, data may help me identify cluster cases in a classroom, school, or grade. I don't have enough time today to show you all of the reports, but I will share a few that will be vital when schools reopen. In this scenario, I will use data from SNAP to help my district and state stay ahead of COVID-19 as it evolves. I can do this by identifying health trends and cluster cases. As a student health administrator, I have access to reports. And as you can see here, I can narrow it down by teacher, by grade. There's so much data that I can get using the report generator. I want to take a district-wide overview of what is going on with the absences. So I'm going to select the time frame. So I'm going to look at the past week to see if there are any trends. And here I can sort by reason to see if there's any significant absences. So automatically, I can see that a lot of students have been out due to a skin rash. If I narrow this down by grade as well, I can see that there's an issue in the second grade with a skin rash. So I know a couple of these kids are actually in the elementary school and in Miss Rainey's class. And sure enough, it looks like something's going on within that classroom. So with this data, I can share it with the health department. Maybe this is a new symptom. I can also add the functionality to the health surveillance piece so that I can continue monitoring and see if this is happening more often. You know, is it just this one area? Maybe it has nothing to do with COVID. But again, being able to stay ahead of trends and identify trends is going to help your district and state get back to normal quickly as possible. Looking at conditions, again, having that same date, I want to take a district-wide view and choose the condition I want to review. So again, sorting by grade, I can see that there are several students in the first grade in Miss Dawson's class that were called in with a diagnosis positive for COVID-19. So again, the health department may already have this data, but they may not be aware that there's a cluster case in Mrs. Dawson's classroom. So this might help detect an outbreak before it occurs. So in this scenario, I just shared how you can run reports to identify new trends and cluster cases, helping you stay ahead of COVID-19. As a student health administrator, I had a view of the entire district. I have the opportunity to take action before an outbreak occurs. SNAP Health Center includes COVID-19 templates to help guide schools with the reopening process. Templates help reduce time spent documenting and provides district-wide protocols. They're completely customizable, enabling you to meet your specific requirements and can be modified as COVID-19 evolves and recommendations change. In this scenario, I will share one template that might be helpful during the reopening phase. So this is one I already started the visit. And again, using one of the templates that were provided to me by my SNAP program, I was able to customize it to make it meet my district specific needs. But all of this information was populated over here to the left. And now I can add my notes. So as I just left the meeting with the superintendent, with the director of health services, and we decided that hand sanitizer station and disinfection sanitizer stations were needed in each room in every building. We also discussed the PPE that we would order. And we also discussed SNAP's health surveillance feature, and we'll meet on the 17th to implement. And I need to, again, keep the nursing staff up to date, and I can do that by sending an email. So all of my notes were automatically populated into this letter. I'm going to send it over via email. Any of our emails are password and FERPA HIPAA compliant. And here I can check off that I want to include those that attended the meeting and then any of the staff. So being able to communicate information with the nursing staff is very simple, and also keeping others in the loop. So in this scenario, I was able to document, track, and communicate all progress associated with the planning committee. As a nurse leader, SNAP helps me manage my clinical documentation as well as health services activity, while providing me a secure method of communicating with parents and staff. So I'm very excited to announce, because you're all the very first to hear about it, we currently are in active development of new COVID features. Specifically, we are addressing the need for student COVID reentry screenings that can be completed and securely submitted electronically by parents or district staff. This means screenings can be done by mom or dad from home prior to their child going to school, or district staff can perform individual reentry screenings as students arrive at school and electronically send the results to SNAP. These new features will be built directly into the SNAP Health Portal, and we aim to have this new functionality available for the start of the school year. If your district requires screenings upon entry, either now or in the future, SNAP's out-of-the-box screening forms will enable you to document past screenings with just a few clicks, and documenting reason for non-entry screenings is just as simple yet complete. In addition, SNAP can accept imports of district staff from your SIS so that you can document and track reentry screenings for the entire population. In this scenario, I'll be demonstrating how quickly you can document screening results for the nurse or delegated staff, and how this information can be shared with your administrators. In this scenario, I'm the high school nurse, and it's the first day of school. I need to document all reentry screenings that I provided, as well as any that were done by delegated staff. I have 10 volunteers that have been trained on reentry screenings. I gave each volunteer a list of students based on grade, and the lists are being returned to me to document in each health record. So I'm creating a list of students that are in the 9th and 10th grade. Now I have this, they're creating a group. Now I'm going to pull out Jack because he was sent home with a cough. Joseph had a fever, and Dennis did not pass his screening as well. So all of these students here are now in my group. And now I'm going to group process a reentry screening. And I'm going to use the detailed form. Now these screenings were done by Jane Smith, and she is a UAP. So there, in less than 30 seconds, I was able to document screenings for the entire group. So there are the results. And as I toggle through, you can see the results are in each student's health record. So taking a look at our screening templates, we see here there are a few. So we have detailed and temp only. The elementary schools are using the temp only, very simple, straightforward screening. And we've decided in our district that the high schoolers and staff, we would do a questionnaire. So what SNAP does is it adds defaults when you provide the screening. And if I do have a student that did not pass, they had a temperature and a cough, it's very quick to document. Now, as COVID-19 evolves and our district policy changes, the health administrator is going to come in and customize this form and change it as needed. Now, my district also requires me to send an update of re-entry screenings. So my principal needs it on a weekly basis. So I'm going to document in my health services record. And I'm going to use one of the templates provided by SNAP, and that is the re-entry screening summary. So after the screening had been done, I document that 80 staff members were screened, 1 was sent home, and 740 were screened and 2 were sent home. Our district is not allowing visitors yet, so I document those as 0. And now I'm going to send this to my principal via email, just like I did in the previous scenario, and it will populate all of that information. So as the principal, I just received this email from SNAP that includes the screening results. I don't have to make any phone calls. I don't have to call any meetings. Again, the nurse is able to communicate information with the principals, superintendents, whomever the case, and everyone's kept in the loop. So in that scenario, I was able to document past criteria screening results for 2 grades and communicated screening results for the entire school in seconds. As a nurse, SNAP's templates and group processing expedites my documentation, saving me hours of time. SNAP also enables me to provide valuable data to my administrators. Sorry about that. So if you do decide to have a staggered schedule with some students on site and some online learning, you can create track schedules in SNAP. And student tracks can be imported right from your SIS, which allows you to separate students into different schedules. SNAP tracks will assist with the reporting and scheduled orders for the day. In this scenario, I'm the middle school nurse, and I need to be able to track the students that are in school with scheduled treatments, procedures, and medications. I also need to check in on my students with health conditions that are learning from home. The first thing I do as a middle school nurse every morning is to view my scheduled orders for the day. This list shows me the scheduled medications and treatments or procedures. My schedule only includes students that I have a track of on site. Last week, before I had the SNAP tracks, I spent hours trying to hunt down students that did not come in for a scheduled order, only to find out they are online learning this week. Now for my online learning students that have conditions, I want to provide reach out. So I'm going to do this by running a report. And I'm going to narrow it down by track. I only want to see the health records of students that are online learning. And I also want to just have those students in this group that have a serious health condition. So here's my list. So I know I need to reach out to Paula, Claire, and Robert. Now, because I created a group, I click on the group button and I go right to Paula's health record. And because we can import information from any SIS, I have current updated information. So I know mom's contact information is correct. And I can see what conditions I need to reach out to mom to discuss. So I can also document this as a case management. So here I can document my conversation with mom. I gave her a call to check in to see how Paula's been managing her asthma. And mom tells me that over the past week, her asthma symptoms have improved significantly. So documenting the case management, very, very simple, straightforward. So in that scenario, I was able to identify all of the on-site students with a scheduled order and was able to reach out to all of my online students with a health condition and efficiently documented their health status. As a nurse, SNAP helps me manage my day-to-day activity and keeps me organized. At some point, we hope a vaccine will be available. And SNAP is known for being the most accurate school-based EHR for state-specific vaccine compliance, and SNAP can link to more than 15 state immunization registries. And there's several registries out there that are truly bidirectional, meaning they can accept data right from SNAP, which is going to help close gaps and support your state's return to normal as quickly as possible. So the vaccine data is pulled right from the registry database and populated into SNAP. Our immunization module saves an immense time for nurses with data entry, hand calculations, and chasing parents. In this scenario, I will be demonstrating the ease of documenting administered vaccines, running compliance reports, and communicating non-compliance in just seconds. So I am the elementary nurse, and my district has set up a vaccine clinic at my school. I just administered vaccines for the first, second, and third graders. I'm back in my office and will document administered vaccines. So there, I've created a group of all my first, second, and third graders. Now, John did not receive a vaccine because he already had one from his PCP. Kevin has not received a vaccine and his mom is refusing at this time. And Hannah also did not receive a vaccine, already had one from their local pharmacy. So now I have all of these students in this group. So I click OK, and now I want to document those administered vaccines. Now, once your state requires, or if your state requires, I should say, a vaccine for COVID, it will be included with your state-specific calculations. And that way you'll be able to easily run compliance and document administrations. So again, in just seconds, I was able to document that administration. So as you can see here, it's been added right to every health record. And again, includes all your state-specific vaccines. Now, I also want to communicate with those parents that their child is non-compliant for vaccines, or I'm still waiting for proof. So with that group of students, I'm going to identify anyone, whoops, sorry about that. I want to narrow it down by vaccine. And I can see here the students that did not receive a vaccine or they have not brought in proof. So I have my list of students. I place them in a group, and now I'm going to communicate with the parent via email. Again, it's secure, FERPA, HIPAA compliant, and I'm just going to choose all just in case there's other vaccines they need to bring in proof. And again, I can send out email or I can print it. And because this student's primary home language was Spanish, it chose a Spanish letter. But now all of these can be, again, sent out via email. So in that scenario, I was able to document vaccine administrations for 3 grades. I ran a compliance report and sent an email to all the parents that need to send proof. As a nurse, SNAP saved hours, if not days, with vaccine data entry, immunization calculations, and communicating information with parents. As a health administrator or superintendent, I feel confident that the district will pass an immunization audit and the district population is fully immunized. So this concludes some of the scenarios surrounding school reentry during COVID-19 and how EHRs fill a critical need now more than ever. As I mentioned earlier, none of us know exactly what life will look like when schools reopen. We can only make educated decisions based on the current environment and understand that we will need to adapt as things change. Every state is adapting the CDC guidelines for reopening schools based on their specific needs. There's no doubt that guidelines will continue to evolve and change in the months to come. What we do know is that a complete and flexible EHR is a vital tool during a pandemic to manage the health and safety of students and staff. Right now, SIS systems are laser focused on adapting learning to a virtual environment, not the health monitoring and coordination of students and staff. SNAP Health Center is a comprehensive EHR designed to not only manage student health records, but coordinate healthcare, provide in-depth insight into the overall health of your student population, and most importantly right now, manage community health during a global health crisis. So I know we've covered a lot here today, but I've only touched on a small fraction of what SNAP Health Center can do. Given the time, I want to be sure that we leave space to answer all of your questions. So Ryan, if you have any questions that have already been submitted, I'm happy to start answering them.
Yes, we sure do. Thank you, Christine, and thank you for taking the time to give this this important information to us. For questions, I'm going to start off. We've got a couple of questions that were asking a similar sort of thing, and so a couple of people are wanting to know if health trends and emails are automatically placed into SNAP as you know time goes by, and the alerts, the SNAP emails and the pop-up messages, are those included with SNAP, or is that a separate product that you get?
If I'm understanding you correctly, the functionality for health surveillance is already built in, and here it is. And this is where we have templates already included, but you will have to add in your specific emails. And you'll also have to choose your threshold and how often you want to be notified. And that's why we have several different types, because we're monitoring some of the same things, but if it's the health department, they might only want to be updated every week. If it's your principal, they might want to be updated daily. If it's your the nurse leader, daily. So we give you the flexibility to choose what works for you, but we do have all of these templates that are included, as well as the email templates. But again, you have the option of changing them to meet your specific needs.
Okay, excellent. Thank you, Christine.
Mhm.
When we're talking about sending emails, for example, can you explain how you send emails from SNAP?
What we do is any emails that are sent out, an email before it goes out includes the username and password. The next email that goes out is the actual email, so it might be a letter, and it's encrypted and password protected, so they have to have that unique password to be able to open up the email. All of the form letters can be emailed, whether it's from a visit, immunization, not in compliance, a screening referral. All the district needs to do is set up what's called, and this is a techie term, but SMTP. So they just need to help us work with their email.
Okay, excellent. Thank you. I've got a few questions here that relate more to setup and use of the SNAP Health Center. Can you give us an idea of the time that it would take to get SNAP set up and going, and also what kind of support and training you provide?
So it does vary, but most districts can be up and running within a week or two after the nurses have been trained, and IT provides us an import file. So that's typically what we need. We provide a lot of different training options and also access to our customer portal. So this is a portal where the nurses can watch video training. So there's tons, and they're based on specific topics. They have 24/7 access, and it comes with their subscription. They also have access to downloadable how-tos. And if you're not familiar with our company, check out your listserv. I think there's a closed school nursing Facebook, the NASN listserv, because our tech support is fantastic. They will, it includes nurses. So if you have a question like a complex immunization requirement or a documentation question, you can actually speak with the nurse. But that's one of the things we're very well known for, is our support. And also, due to the current situation, we recently developed an interactive training method. So it takes on a hands-on approach. Even though we can't be there in person, we're able to have the trainer watch and work with you. So it's unique, but it's very, very helpful. And we have a lot of different options.
Okay, excellent. Thank you. How about access? I know that you had mentioned earlier that you can have emails, for example, generated to administrators or to parents. You can have emails that are generated when a threshold of a criteria is met. And with the SNAP program, can you give access to other people within the organization? So can a teacher or a principal use SNAP? Can parents access any of the information that is in SNAP?
So basically, because it is developed for nurses specific, typically only nurses or school health workers use the EHR. The nurse can share information like I gave you, showed with the principal with a letter, but typically they don't go into the program. We do have a portal, a health portal, and this is the one that I was explaining is being further customized. Let me just get in here. So this is a health portal where parents can view health information in real time. It's in a controlled environment, so the nurse decides what information is shared. Parents can update information. They can electronically sign and submit forms. And staff, you can allow staff to have access, again, to limited health information. So the health information being again, what the nurse decides. So if it's the principal and they need to check in on something, you have the option of allowing. If it's a teacher on a field trip, you can provide them health information and they can access it right from their smartphone.
And so looking at something like this, I'm thinking of a scenario where a parent can upload a form. Perhaps a student has been out with COVID and has a release from the doctor to return to school, and that could be uploaded by the parent into the system.
Yep. So you can have your own form. So these are examples of forms that I have sent out to the parents to complete. Some of them require signature as well. And also, if you require a proof, say, of a vaccine, you can have them upload the proof here. Or if it's a condition, you can have them add an attachment to the condition. So you can give them some direction on adding that information or entering it. Or they also can message the nurse as well, and then include the attachment. And it can be done a picture from the smartphone as well.
Okay, thank you. We've got some questions that are coming in on templates and specifically the ones that we've been using today. So the ones you've been showing us today, are they already created for users of the Snap Health Center, or are these ones that you put together just for the training that we're seeing?
So there are several sample templates that are included with the program. And these COVID ones are specifically included. So you have your standard, headaches and things like that. So all of these templates, the sample templates that are included can be customized, or you can create your own from scratch, and they're very easy to create. But these templates here are all included with the program. And actually, let me just go back out. And they'll automatically populate. So this is an example of the tracing summary template. Again, fully customizable, which is going to be super important as COVID-19 evolves or your district policy changes.
And speaking of the evolution, it seems like one of the things that has remained constant with COVID-19 is that it is evolving. Our knowledge of it is evolving. So the templates that we're seeing here, do we see updates that come from you as we learn new information about COVID-19?
What we've done, so for example, with our current customers that had the program prior to COVID-19, we provided ways to help them, support them set up the templates to set up and customize it to meet those needs. So that way, as we learn things, we'll continue to provide different trainings and webinars and training materials to help them continue to work with the program as it evolves.
Okay, and that relates to another question that I saw. It looks like someone who is a current user of SNAP but is not seeing the COVID templates, and so she's wondering if there's an update or a restart or something that's required for her to be able to see those.
They'll actually create the templates. In fact, when I had my program, so I have my SNAP, and it was not customized like including these templates here. I took the training guide that was provided by the nurses. So we provided a COVID specific overview webinar a month and a half ago. And then we broke all that you saw down by training sections. And then what I did in my database, so this is not a brand new database, I made all those templates myself. And I can tell you, because I'm not a nurse, I was able to do it rather easy. So the customer should be able to do it rather easy as well. So just reach out to the tech support team and they'll get you those, the how-to, and help you set that up.
Okay, great. Thank you, Christine. I heard you mention a little early on in the presentation that we're only looking at a small a small amount of what SNAP can do for a nurse or for a school system. As we talk about other functionality, are there other areas, other professionals within the schools that might be able to use SNAP as well? And we're looking at specifically like a school adjustment counselor, a school psychologist. Are there resources for them within SNAP?
Yes, so it's not super common. Nurses are typically the most common user of the SNAP program, but we do have counselors and social workers and other provider types using the software. And SNAP does include a section for documenting behavioral health. So it does already include that language in the program. And what we see the districts doing is that they specifically have this section used by counselors. So that way it doesn't get mixed up in their reporting and so forth. So it is right here. And we do have it. It's just that we really focus on school nursing, but we do have the ability for other provider types to document behavioral health information.
Okay, excellent. Thank you.
Mm-hmm.
How about staff health records? Can they be kept in SNAP?
Yep. So we do have districts that are currently using the program and having their staff in. So one of the reasons why they do is because a lot of teachers are coming in for medications, whether, over-the-counter ibuprofen or Tylenol, or they're having their blood pressure checked. So the nurses want to be able to document and track that. With the screenings that will, for COVID, it would probably be ideal to have the teachers and staff in the SNAP program so that you're able to track their screenings. So I showed you some of the reentry screenings that had been done for staff, or excuse me, for students. They can also be done for staff. As I mentioned before, we're going to be enhancing the SNAP Health Portal to make it easier for the, not having to do the screenings and go back, but they'll actually be able to do it on site or prior to going to school. But the staff records can be imported right from the student information system. So that will help populate and give them each a health record.
Okay, excellent. Thank you. I've got a question here about probably an integration. Are you familiar with PowerSchool? And if so, do you work with PowerSchool?
Yep, so we work with any student information system. I want to say there's at least 50 different ones that we work with. And we bring in a lot of data so the nurse has all the contact information and it's updated at least every evening. And we do have certain SIS that we partner with, and PowerSchool is one of them. We've been a partner since 2011, and we have about 3,000 or more mutual client schools. And when we have these different partnerships, it enables us to have a better integration. We provide easier, seamless tools for IT so that it helps support IT. And then we can also do things like have a single sign-on for parents and staff through a portal. So that way they can go into PowerSchool and then they log into SNAP Health Portal without having to have multiple passwords, and it gives them better compliancy to get those parents to take the action the nurse wants.
Okay, excellent. And seeing a question here related to telehealth, I'm feeling like the answer is yes, based on some of the things I've heard you say before, but can SNAP be used to document telehealth visits?
Yes, we do have nurses, especially it's pretty popular in South Carolina. And also now with the COVID crisis, we anticipate that it may become even more popular, and all those visits can be documented using our standard visit log.
Okay, wonderful, thank you. All right, I think that we are getting close on time for the day, so I'll go ahead and wrap up. Thank you, Christine, for taking some time to answer the questions that have come in to the audience. If we did not happen to address the question that you sent through, please know that we will work to reach out directly to you with an answer to your question. We did have a number of questions that came in during the presentation, and I know that we got through a good portion of them, but if we did not happen to answer your question, we will reach out to you directly with an answer. As you're exiting the webinar today, you will see a survey that comes up after you close GoToWebinar. We'd ask you to please participate in that survey to give us an idea of your thoughts on how we've done here today, things that you might like to have seen differently, or things that you really enjoyed seeing. Also, just a reminder that this presentation is being recorded. I saw a few questions come through about, that we had a lot of information and it moved very quickly. And if you'd like to review this presentation or be able to look at it again, but pause it at certain times as you make notes or explore within your own system, we will send that recording out later this afternoon so that you can review the presentation and share it with your colleagues. And that wraps everything up for us today. Thank you for taking the time for this presentation, Christine, and the folks with Snap Health Center and PSNI. And I will, at this point, end the webinar. And thanks everyone for their time and attendance.
Thank you, Ryan.